Why is diverticulitis abscess drainage treatment so long? When dealing with a diverticulitis abscess, you might wonder why the treatment takes so much time. The process involves carefully removing infected fluid from the body while allowing the tissues around it to heal slowly and safely. Usually, a drainage tube or catheter is placed into the abscess to continuously drain pus and infected material. This tube often stays in place for several days up to a few weeks. The reason for this extended period is to make sure all the infected fluid is fully evacuated and to prevent the abscess from coming back or causing further complications. Abscesses are basically pockets of infection that develop in the tissue. These pockets are walled off, which means the infected material inside cannot be quickly or easily removed. If drainage is rushed or incomplete, the infection could spread or return. That's why doctors prefer a slow, controlled drainage process. Using imaging guidance, such as ultrasound or computed tomography scans, doctors insert a small tube through the skin into the abscess. This minimally invasive approach is safer than open surgery but requires patience to allow the infection to clear completely. The size and complexity of the abscess also influence how long drainage takes. Larger abscesses, especially those over 3 centimeters, tend to need longer drainage times. On average, patients might have the drainage tube in place for about 8 days, but it can be longer depending on how the infection responds to treatment. The goal is to allow enough time for the pus to drain out and for the infection to shrink, which helps prevent the abscess from bursting or spreading. Another key reason for the length of treatment is to reduce the risk of complications. Slow drainage helps prevent the abscess from rupturing unexpectedly, which could cause the infection to spread into the abdominal cavity. It also allows doctors to monitor for issues like fistulas, which are abnormal connections that can form between organs if the infection isn't fully controlled. Along with drainage, antibiotics are used to treat the underlying infection. The abscess cavity needs to heal and close up before the drainage tube can be safely removed, which takes time. Every patient is different. Factors like overall health, immune response, and other medical conditions can influence how quickly someone heals. Some people may need the drainage tube for just over a week, while others might requiring a longer period. Hospital stays usually last several days, with follow-up visits afterward to ensure the abscess has resolved completely. In summary, the treatment for a diverticulitis abscess is intentionally slow because it's about balancing effective infection control with safety. Proper drainage, combined with antibiotics and careful monitoring, helps ensure the infection is fully cleared without rushing into surgery or risking further problems. This thoughtful approach aims for a complete recovery, preserving your health and well-being. Always remember to consult your healthcare provider for personalized advice and treatment options.